Welcome to the highly anticipated debate session of the 10th Cohort of the Policy Advocacy in Genetics and Genomics course, a flagship program of the Pan-African PGS Education and Research Initiative, PAPERI. This transformative course continues to unite a vibrant and diverse community of professionals across Africa and beyond, equipping them with cutting-edge genomic knowledge and empowering them to champion bold, ethical policy reforms in health and research systems. In this 10th cohort, we are proud to feature passionate, forward-thinking participants representing Sierra Leone, Cameroon, Nigeria, Uganda, Kenya, Sudan, and Libya, each bringing regional insight, scientific rigor, and policy passion to the forefront. Today, these rising scientific and policy leaders take center stage in a series of high-stakes, evidence-driven debates, tackling some of the most urgent ethical and strategic questions in the future of genomics and public health. Get ready for a powerful exchange of ideas, critical, creative, and globally relevant. This isn't just a debate. This is the voice of a new generation in genomics policy advocacy.
Hello, my name is Ella Milani from Cameroon. I am a final year veterinary student. I will be debating on the topic, should mandatory genetics-based vaccination policies be implemented for public health? I will be on the negative team. Wait for us. Thank you.
Hello everyone. I will be participating in the debate to oppose the topic, should genetic profiling be used for border security and immigration policies? For me, no. Why? Because while security and immigration control are important state responsibilities, employing genetic profiling as a tool for these purposes presents significant ethical, legal, and societal dangers. It risks undermining human rights, promoting discrimination, and creating precedents that harm rather than protect societies. More so, DNA can't reveal intent, beliefs, or behavior. Security risk stems from actions and not ancestry. Profiling based on genes is scientifically flawed and risks wrongful suspicion. My name is Dr. Olufemi Amo from Nigeria. See you at the debate. Thank you.
With the increasing movement of people and goods across borders, governments face a challenge of finding the right balance between keeping the borders open and keeping them secure and controlled. That's why I'm on the affirmative side of the topic. Should genetic profiling be used for border security and immigration policies? Wait for us on the upcoming debate. My name is Kevin Ojambo from Uganda.
Hi everyone. I selected the topic, should community consent be mandatory before conducting genetic study on parasitic carriers? And I'll be on the negative side of this debate. My name is Oluwafemi Joseph. I'm from Nigeria, and I can't wait to see you. Thank you.
Hello everyone. I select the topic, should community consent be mandatory before genetic studies in parasite carriers? Making community consent mandatory before conducting genetic studies in parasite carriers is critical steps toward ethical research practice. The ethical debate in community consent in genetic studies, especially parasitic disease, is critical step for public health, research integrity, and community well-being. Highlighted it is important in genetic research. I will be in the affirmative team. Please wait for us. My name is Fatih Abdullah Muhammad Ismail from Sudan. Thank you.
Hello, I'll be participating in a debate titled, should contact tracing apps include genomic data to track transmission patterns or exclude genetics to avoid discrimination? I will be in the negative team to argue that its exclusion is the best. Looking forward to see you on the live debate. I am Abdulhakim Yusuf from Nigeria.
Hello, good morning. I selected the topic, should contact tracing apps be included in genetic data to track transmission patterns or exclude genetics to avoid discrimination. I'll be in the affirmative, and I'll be supporting this motion. And my name is Arewa Debukola Jeremiah, and I'm from Nigeria. Thank you.
Hello everyone. The integration between the genetic testing and antibiotic stewardship program is essential for our society that help the healthcare workers to take precise treatment decisions, subsequently improves the patient's outcome and reduce the antimicrobial resistance. My selected topic: should African governments can penalize the hospitals and clinics that fail to adopt the genetic testing for antibiotic stewardship program. I'm Halima Fatih Abdiri. I'm from Libya in the affirmative group. Wait for us.
Hello everyone. Antibiotic resistance is a ticking time bomb in Africa. Because of the drug-resistant cases, there's thousands of people die there. One of the most possible causes is that ineffective antibiotic stewardship. So that's why genomic testing, it will help us to analyze the bacteria on a DNA level, at a molecular level. And it will also to help us to pinpoint at the right antibiotic, so thus reducing the cost and the resistant cases. Stay tuned everyone. My name is Dr. Nazia Saad Khamis Abdallah. I'm one of the affirmative group in group 5. And the topic is that should African hospitals get penalized because of ignoring their genomic testing?
This motion already assumes that hospitals can carry out genomic testing protocols. However, most hospitals lack funding, trained staff, and infrastructure. In Nigeria, you find out that a lot of patients pay out of pocket, and most pharmacies sell antibiotics without the doctor's prescription. So if you're penalizing these healthcare institutions, you're not being fair and it's going to be ineffective. My name is Tolulope Olede, and I'll be speaking against the motion that should African governments penalize hospitals and clinics that fail to carry out genomic testing protocols for antibiotic stewardship programs.
As we conclude, we warmly invite you to join us for the live debate session on Sunday, August 17th, 2025 at 3 p.m. Cairo time. Witness emerging scientific voices challenge assumptions, propose solutions, and debate the most complex and timely issues in genetics, genomics, and public policy. Don't miss this opportunity to celebrate scientific excellence, amplify leadership, and help shape the future of health innovation and equity. Together, we can drive meaningful change, ignite advocacy, and build a genomics-ready Africa for today and generations to come. Let's make it happen.